Hey, Danielle, this is Jim Shotwell.
Yeah, hi.
Howdy.
Hi.
Could you forward me a phone number, your office number that I could reach you at?
Yes. Yep, I'll send it to you right now.
Thanks.
Okay, thank you.
Good afternoon.
It would take all my points that I own because it's so. But
Good afternoon, everybody. It is 12 o'clock, and I would like to call the Human Services Committee to order. And first item on the agenda is approval of the agenda. Mr. Bear and Mr. Kennedy, thank you very much. Any additions, deletions, or corrections on the agenda? All right, seeing or hearing none, all in favor, show the sign. All right, passes unanimous. Thank you very much. Next item on the agenda is public comment. Is there any public comment today?
No public comment today.
Thank you very much, Michelle.
You're welcome.
All right, that brings us down to committee items. Item A is approval of the minutes from our September meeting. We'll be looking for a motion and support to approve our minutes from the September meeting.
Move to approve the minutes from our September meeting.
Thank you, Mr. Bear. Seconded by Mr. Williams. Any questions, corrections, deletions on the minutes? Seeing or hearing none, all in favor say aye or show the sign. All right, passes unanimous. Next item on the agenda is appointments. Looking at the appointments, we have one open seat on the DHHS board. It's a public member. Betsy Youngdow was the current member. There's no current applicants and no committee recommendation right now. The Sanitary Code Board of Appeals still has 5 open seats on it that are all vacant. And the MELF committee is still showing vacant. Are there any, is there any nominations from the floor for any of these positions from the committee? Okay, seeing or hearing none, we will move to the next item and just note that those are open, and let's reach out to some people to see if we can get those seats filled. Next item.
Mr. Chair,
Yes, sir.
can we reach out to Betsy and see if her term just expired and she didn't know that she needed to reapply, or if she resigned? Because could fill that one easy if she didn't know about it.
Absolutely. I see Michael shaking his head. Yes. Okay. All right. So we will reach out to Betsy and find out what's going on. I did also text Zoe Lyons from DHHS just to try to get some more information on the commitment for that committee as well, just in case we do have to reach out to some other individuals interested. Okay. I think that takes care of appointments today, unless there's anything else from anybody. Okay. So we'll move down to the Lifeways monthly report. And I
Okay,
do
it's
see
Mary Beth. Can you hear
down.
me? Can you hear me?
How you doing, Mary Beth? Yep.
Okay. So you'll see in your packet is this month's board commissioners report relative to the activity occurring at Lifeways. A couple of things. We have applied. We're kind of excited about it. I guess we'll wait and see if it actually comes to fruition. But we did apply for a Michigan Blue Cross and Blue Shield grant for about $75,000 to be able to implement a evidence-based model of zero suicide. What's really important about that is there's a couple of key components, and you'll see the narrative kind of explains it out in detail, but one is really giving clinical staff the ability to do a simulation, if you will, a role play, to advance their skill set around identifying, assisting individuals who are having suicidal thoughts. The other thing that I'm really excited about is if we're able to get this grant is we are looking at using some technology to allow us to be able to put into the community, especially in the underserved areas in Jackson, a kiosk, if you will, that would allow them to be able to connect with a live, directly with a live clinician at Lifeways. So this is a model that's utilized in other communities across the United States, and we're hopeful that maybe we would be selected for this grant, but I'll keep you informed about that. That's a pretty exciting opportunity should we be fortunate enough to be selected. The other thing that we're involved in is a partnership with Henry Ford Allegiance around initiative called the Black Indigenous People of Color Campaign. And you might have seen this on our Facebook and our website. We are reaching out to be able to hear from those to raise awareness for us as a community mental health about the unique struggles that underrepresented groups have when they're trying to access mental health. Will allow us to be able to develop some strategies to better outreach and to be able to serve them better. So we're still having that campaign go on. If you know anybody who's interested in providing feedback to us, please check out our website. And again, that's a partnership with Henry Ford Allegiance. The other thing that I wanted to give you an update about is relative to the millage. So we are in, we've completed our second year, or second quarter. So you'll see in your packet data that represents the outcomes for the mental health millage from January through the end of June of this year. I will point out, and it is indicated on that sheet, that we did have some impact, as many people have, as a result of COVID, where we did see a decrease of individuals accessing services, desiring services as a result of COVID. But we are now at the point where we're almost back at the level, if not in some crisis services, higher than we were prior to COVID. But there was a decrease for a period of time of services that we were able to provide during that second quarter. You'll see in here that we provided over 2,600 total services in the community. We provided services in the jails. That one, we did still see a high utilization of mental health services for individuals that were in the jail. It was primarily for those that are uninsured or underinsured who would have come to our door, who people weren't coming in there for a period of time. We also provided over 154 trauma services to over 11 schools in Jackson County during that time period. We also supported social enrichment activities for the community, and over 1,000 people were served for the intellectually developmentally disabled. And then we continue to support the mental health services in the schools as well. And again, there was a decrease during that period of time, but again, we're starting to see things return back to the normal state. And in some levels, especially as it relates to crisis services, they're increasing. The other thing that we're seeing as it relates to crisis services is that the acuity of individuals that are showing up needing crisis services are pretty high. And I think that's because people went without accessing services during the COVID, the height of the pandemic, if you will, even though we're not really out of the pandemic yet, but people are starting to re-engage. And because some people delayed access, it does increase their acuity level when they do show up needing mental health services. So I don't know if there were any questions about the outcomes. That was something that we, I had committed to make sure that I keep the board appraised of relative to the use of those funds. So I will now open it up to any of the questions by any of the commissioners.
Commissioners and committee members, what questions do we have? All right, I don't think we have any questions. Mary Beth, did you have anything else for us today?
No, that's it.
All right. Okay, well, I think that is it. Thank you very much for your report.
All right, thank you.
Have a good day.
Thank you.
And next on the agenda is the medical care facility financial report. We have Destiny on from the medical care facility. I'm checking to see. I don't see her. No, I don't see her on. And let's see. That report definitely got reloaded. It's a lot clearer. Thank you so much, Deb or Mike, whoever reloaded that back up. It was pretty blurry earlier, so I didn't really get a chance to review it. Do we need to accept this report, or what's the order of business on this with nobody here to report on it? Do we just need to check it out and keep it moving, or what?
It's really pleasure of the board here. You can receive and file, or or not. Either way, it's on the agenda, shows that you received it.
With that, I offer motion to receive.
Right. Motion received and seconded by Mr. Kennedy. Any questions, comments, or concerns? All right, seeing or hearing none, all so show the sign, all in favor. And all opposed, show the same sign. And looks like we unanimously passed that. Okay, Department on Aging monthly report.
I'm just unmuted myself there. Good afternoon. Just to begin with the report with the home delivered meals, I just wanted to. Oh, hold on, I gotta start my video. Apologize there. Hi. With the home delivered meals, in a previous report, I'd indicated that the cold meals were going to start on September 14th. And I updated it in this report that they actually did not start until September 28th. So I just wanted the commissioners to be aware of that. And some of that was just with program planning and making the changes, since we really hadn't had the cold meals in place probably since mid-March when the pandemic began. So it was something that we wanted to begin again. So we had to work with the vendor to make sure that the products were available. And again, they were well received by the seniors, so they're happy to have their cold meals and have more various options available. Having the cold meals in place also helps with a little bit more with social distancing in the kitchen. So you have particular cooks that are going to be working on the cold meals, as well as other staff that are working on the hot meal program. So again, that allows for a little bit more social distance, which we need to have happen within that production kitchen. And I wanted to just update you. We had heard that the ASA was going to do some promotion regarding respite care. And what respite care is, it's a service which provides relief to, it could be an example like a family caregiver, it could be a spouse, it could be an adult child, it could be a companion, where there's an aide that generally goes into the home to provide support to caregivers in the community so that they can tend to appointments, maybe just get out and do their shopping while knowing that their loved one's taken care of. Within the adult daycare portion of that respite program, we can pay for an individual that needs the supervision to go to an adult daycare. Occasionally we've done overnight respite, but with the pandemic, a lot of the focus is more happening in the home where we're able to provide that support. We have not heard that there's additional funding, even though they're going to be doing some kind of ad campaign around this. But we'll wait and see what happens. It is an area that we've always liked to increase in. I looked at our caregiver numbers that we served for respite from October through September, and it was 62 families that were served in the respite program. And during that time, we did 4,249 hours of service to caregivers to help support that care to have so they can have that break away from their loved one. A benefit with the respite program is working with the coordinators when somebody's having a difficult situation in the home. Maybe they're dealing with a behavioral issue or a family issue, or just need advice on care, or if they need increase in support services, that they can definitely connect with our respite care coordinators and find that additional support and just have that individual to talk to help guide them. And just help them when they're having, difficult days. And sometimes we've looked at counseling services to also help them in the home. I looked at September and just wanted to provide some statistics on the number of people that we served. And these are our unit-based programs. And so that might look like our home delivered meals, our home care assistance, case coordination and support, chore services, which might be like installation of grab bars, minor home repair, also our counseling services, the respite services. And so anything that would be unit-based, I wanted just kind of to give a snapshot of what that looked like for individuals that we serve. And so that's kind of listed below, the average age being 76 years old. We serve a higher percentage of females. Our minority count was about 12%. Our target with our grants is right around 6% with a lot of the programs. Though this captures a lot of the units, or a lot of the programs that I mentioned above, some of them we'd like to see the percentage of minority a little bit higher. The unit-based programs that we didn't include would be, which are, I should say, non-unit-based programs, are like senior center, health promotion. Those ones are more in general of what we try to capture as far as numbers. So there's no units individually tied to individuals. I thought it was nice to see that the oldest person that we're serving was 100 years old. So just kind of a snapshot of who we are for the month and who we're serving. And I wanted to share just a letter that we had received from somebody that received services from us. And she kind of described some different programs that she's involved with and her interactions with staff. And again, I think that just shows the people that we have working for us, how much they're engaged and trying to help the seniors. And it was glad to see some of that recognized. And that letter was shared with the staff involved with that. So, but I can open it up to questions.
All right, committee members and commissioners, what questions do we have today? I do have one question if nobody else does, right quick. I'm just curious what the best route to sign someone up for the meal delivery program is.
Just really just calling our main number, the 788-4364, and they'll get transferred right to Jennifer Guthrie. She's the in-home service coordinator. We usually try to have them go through the direct line in case she's away. She always has staff covering that line. So we can do intakes and start people as soon as possible. It's not unusual to start. It could be the very next day, depending on if it's a Monday, Wednesday, Friday route or a 5-day-a-week route. But we usually can start them right away.
Okay.
We had somebody that called last week. Region 2 had reached out to us, and they had somebody that her husband went into the hospital. She was alone. She didn't have any food in the home. Was mobility impaired, and they called us to get food out to her. Our staff took food out to her that same day, that evening, so that she would have food for the weekend because it was on a Friday. So again, we'll take that food out there definitely to help those seniors as quickly as possible.
All right. Commissioners, are there any other questions for Danielle today? All right, seeing or hearing none. Thank you so much, Danielle. I think we are all set. You have a great day.
All right, you too.
All right, next item on the agenda is the Health Department early on agreements with the Jackson County ISD.
Good afternoon, commissioners and Mike.
Hello.
Can you hear me okay? Sorry.
Yep.
Great. We have quite a few items today to get through for your review and approval. First one starting off is the early on programming. We have this contract with the ISD every year. I apologize, I know it expired in June. We get it a bit late from the ISD, and then also being that we have been in the pandemic response, it took me a bit of time to gather up my stuff and get it into you, so I apologize for that. However, the majority of this is state funding, or funding that we have supported through our contract with the ISD. You'll note in the financials that the health department does contribute in a good faith effort about $14,500 toward the contract. And so there have been some increases, not huge, but probably likely due to costs due to the new year. And just as a reminder, it is 2 contracts that you'll be signing. One is for the local ISD and the other is for the federal funding. We do have to sign 2 separate agreements, unfortunately, but this is for the home visiting program that assists families with children with developmental delays. I also wanted to point out I have Matthew Budd, who's our Director of Personal and Preventative Health Services, who oversees the staff in this program area. So if you have specific program questions, Matthew is available to answer those. You can unmute him. Thank you.
Thank you, Rashmi. It looks like the action that we need to take is to send this to the full board. Committee members, are there any questions for Rashmi about this? If we have no questions, we would entertain a motion and support to send this to the full board. Mr. Bear, thank you very much. Is there a second on the matter? Mr. Pileski, did you have a question? Oh, okay, you seconded. Okay, thank you. All right, seconded by, sorry, I had it on the other screen, had to flip over right quick. So it has been moved and seconded. Any questions, comments, or concerns? Seeing or hearing none, all in favor, show the sign. All right, that was unanimously supported. So thank you very much. That will move forward to next Tuesday. And next item on the agenda is the hiring public health nurses. Rashmi.
Okay, thank you again. And another item for your review. Since we are in the midst of a pandemic, folks, we've had a lot of staff, specifically nursing staff, working overtime and working after hours, weekends and such, responding to the pandemic, doing case investigation and contact tracing, which is a critical part of what public health's role is in all of this. We have about 10 staff working on that effort right now. They have been pulled from our other program areas, immunizations and sexual health specifically. We've tried to maintain a minimal amount of clinics there in order to give the public some clinics to be able to sign up for immunizations and sexual health. But I will note, pointing out, not reading in detail, but the request before you indicates that our cases have increased on a daily rate average. I'll be giving you in my monthly report what we're dealing with right now in terms of what we're having on a daily rate increase. I would say about 15 to 20 cases per day currently we're increasing by, meaning each of those cases potentially have a contact or a multiple number of contacts that the nurses need to get a hold of. The other metrics that I will mention that the state measures us on is how quick are we able to get a hold of these contacts? Are we able to complete interviews? Are we able to at least get a hold of people? Because as you can understand, folks aren't necessarily open to answering their phone when they know it's coming from a government agency. So we try to gain that trust and build that trust. And most importantly is the race and ethnicity is noted on our measurements, because that is key to understanding that the underserved population is in fact being served through this case management and contact tracing. The nurses are having an average of about 35 hours of overtime per pay period. It ends up being like 350 hours per pay period. So as you can see, that would become a cost factor. We want to be able to utilize the funds for this as efficiently as possible. And it amounts to about $30,000 in overtime that we've spent already. And note that the funding source for this, folks, is state money. So how we would like to get this approved is potentially as a short term, at least until the funding is available, that we can have these positions supported. In a great world, I would love to have these positions supported long term. And I'll continue to look within the health department budget to see if we are able to do that. Because as I mentioned, these are nurses who are cross-trained across the board. So they would work in immunizations as well as sexual health when such time that we're ever so lucky that the pandemic will start to slow down, God willing. And then, yeah, so you'll note in the last page, we are asking for us to hire these individuals in a step one. I can work with Richard in HR in terms of if somebody comes in with a higher level of experience. I will note this is a special type of work that not necessarily, if you don't get somebody from another local health department who had worked contact tracing before, it can be challenging to find someone with that experience. So we would like to bring someone in, get them trained, and have them start working as soon as possible. We're looking to bring them in potentially at a step one, but given that we have the money and the funding source, I'll certainly work with HR with your approval if this is able to move forward. A lot of information. I can answer questions.
Commissioners, what questions do we have? Mr. Bear?
Good morning, Rashmi.
Good morning. Or good
thank you, Chairman.
afternoon, sorry.
Yes, that's right. It is afternoon already. Eventually, this pandemic will go away. Eventually, everybody will be exposed or vaccinated. Is this a need currently because of the pandemic, that then this need will not be there after the pandemic has subsided?
So the best way I can answer this, Commissioner Bear, is unfortunately I don't have a crystal ball, but the need is now in terms of the pandemic and because of the pandemic. However, as the pandemic starts to slow down, as you mentioned, I think we'll be needing to catch up quite a bit in terms of our immunization rates for all of our children in our county. As far as sexual health treatments, we're trying to keep up on those so people don't get delayed in their treatment. Folks that have been wanting to get tested, we're trying to fit in as we can. So we certainly will be playing quite a bit of catch up even after the pandemic starts to slow down. So the funding source that I'm asking for today is state funding. And we would, if we are given the approval, we would hire these individuals with the fact that they know this is short-term funding with state money that we know is available for at 1 year at this point is what we know it's available for.
So they will know that there's a possibility that when this funding source is gone, their job will be gone.
If we're not able to find an alternative funding source within the health department, then yes.
All right, thank you.
Thank you, Mr. Bear. What other questions do we have, commissioners? If no other questions, we'd be looking for a motion and support to send this on to the full board. We'll give us some more time. Moved by Darius, supported by Mr. Bear. And any questions to the motion? Seeing or hearing none, all in favor say aye or show the sign. All right, that moves to the full board. Thank you very much. And that brings us down to Health Department combined 2 part-time positions to develop a one full-time nurse position. Rashmi.
Okay, thank you again. Another request is also for a nurse. We're utilizing our nurses in the pandemic as much as we can. This is a position that was recently, well, it was in the springtime, vacated due to a resignation by a health educator and then a retirement by a part-time nurse. Understanding that recruitment is more advantageous for a nurse, given if it's a full-time position with benefits, it's easier to be able to attract individuals and get them to give them full-time work. And certainly the work is there. So this position is specifically for the FEMA program, I would say, because we have to continue the work in that regard. We have a state under our state contract. This is part of the money we receive to do fetal infant mortality review is what FEMA is for. However, as I mentioned, any and all nurses might get pulled into work in COVID at any given point in time, since that is our priority right now. So we have that advantage of hiring this person in for FEMA, utilizing state funding. I believe we have a bit of county funding going into this, but not very much. I'm trying to find the dollar amount, excuse me. I'll continue talking. Let's see, we're looking to hire somebody either at a step 1 or step 2. This might be a position that we can actually find somebody who comes in with some level of experience so that they're able to hit the ground running and continue that work to reduce infant mortality. I believe the majority of this is state funding, folks. So that funding source is what would support this position. So we'd like to make the 2 part-times, combined to make 1 full-time.
Mr. Palevsky.
Thank you, Mr. Chair. Just a couple of questions for my clarity. So if I understand, Rashmi, a portion of this person, this new spot, even if it's a step 2, the incremental cost to the county, if I see the spreadsheet here, is about $6,800 a year. That's not terribly expensive. And it seems to me that some COVID monies might be reasonably allocated to get that from and that's the state funding that you're talking about. So thank you. You're still nodding your head. That's all I'm understanding properly. And I guess I would just ask the administration that this is consistent with our budget and that the administration agrees with the concept of combining these two part-time positions into a full-time spot.
I do. Rashmi's arguments are sound, and we have discussed that obviously these positions are only good as long as we have funding available.
That's all I have, Mr. Chair. Thank you for the chance to ask a question.
Thank you, Mr. Pulaski. Let's go Mr. Bear and then Mr. Williams.
The attached file that's supposed to show the financial breakdown, I cannot open it. So before this gets reviewed and voted on by the full board, I don't know if my equipment or this file needs to be corrected, but I would like to read I'd like to be able to read the full thing.
I think it's an Excel file, Commissioner Bear. It was attached to the whole request. I guess I could try to send, it wasn't an Excel document that was.
All right, let me try opening it.
Tony, when you click on it, sometimes it downloads to the bottom of the screen or the bottom of your board docs. That's what it did for me.
That's what it did on mine also.
So check the bottom, very bottom of your screen.
Okay, all right, probably my fault. Thank you.
Commissioner Williams.
Thank you, Mr. Chair. This question is for Ms. Travis. I was just curious if we were able to hire someone with a vast array of experience, would we be able to use them more versatily around the health department?
Absolutely, Commissioner Williams. I think that comes with some level of training, though. I'll say that with the caveat. Again, ideally, if we got somebody from another local health department or say came in from another program parallel to what we have in another state or something like that, we would definitely cross-train as much as we can and utilize people's skills to the full advantage. We could use help everywhere and anywhere in any of our areas for nursing right now in terms of staffing. So yes, we would definitely use that most effectively.
And that wouldn't hinder any potential state dollars that we would use?
State dollars? No, as long as we're allocating it. So a person usually records their time on their timesheet for a percentage. So in that example that Commissioner Pulaski gave of COVID, they would mark it to that code for COVID, and we would appropriately budget to that program. So it shouldn't impact state funding as long as a person is accurately reflecting the hours they work during the course of those 2 weeks.
Okay, thank you. I have nothing further, Mr. Chair.
All right, any other commissioner questions for Rashmi on this matter? If not, we would be looking for a motion and support to move this to the full board. Thank you, Mr. Baird. Thank you, Mr. Williams. It's been properly moved and supported. Any questions to the motion? Seeing or hearing none, I'll show a sign. Oh, sorry, Mr. Williams.
I'm sorry. I just thought of another question. Is there any way we could market this as we're seeking to fill the position as a versatile position?
I think in our job description, Commissioner Williams, and I'll make a note, I think it's written, all our public health nurses positions are kind of broadly written. Okay. And then certainly in the interview process, we can also convey, as Matthew and his team do that interview, that, you know, we may pull you into other program areas where the needs lie. FEMR would be the priority, though, I want to stress, because that is what, you know, we need to utilize the state money for and to assure that we're meeting outcomes and priorities there. But yes, if we need them, certainly COVID would take priority after that and then down the line.
Okay, thank you. Sorry, Mr. Chair.
It's okay. All right. All right. All in favor, show the sign. All right. Supported unanimously. And last item on the agenda is the monthly report.
Okay, I'm just about done, folks, so hang in there with me. I do want to mention, as far as hiring, something that I hope to bring to you next month is we're looking to get an epidemiologist on our team. That's critical to understanding what is the data telling us, where are we going with this, reporting out for schools, numbers, things like that. So don't have that in this month's packet because I didn't have a chance to research that in full, but hope to bring that to you next month just as a teaser to let you know about that. On my monthly report for administration, I'm not going to spend too much time on Eastern equine encephalitis. Seems to be under the radar right now, knock on wood. Still had 2 cases of deer in Jackson County. There are 2 human cases in Montcalm County and Berry County. So won't see any more about that, and no more spraying scheduled as of now. On the health education side, hearing and vision, we continue to do the screenings, but it's been somewhat challenging in that the schools obviously have a lot of priorities with online learning and face-to-face learning that some of them aren't allowing us to come into the school, so that's causing a delay. So that's one example of catch-up we'll be playing there to continue to get our kiddos screened for hearing and vision. People are going the extra mile. We've got staff that are accommodating the school schedules and trying to be accommodating to the school there. But so far, and good news wise, we've screened about 300 students for hearing and 523 for vision. Some of the programs of note for our teen pregnancy prevention programs have continued, although it looks a little bit different, have been doing quite a bit of things virtually or outside while the weather is still nice, in groups of less than 10, still continuing to do the education, providing some mentoring aspects, ways that they can serve the community, things like that. Our Teen Advisory Council, which we're very proud of because it helps to bring people that have been in the program before and can play a leadership role and help us here because that's part of our engagement to be able to bring those folks back. We held that on August 29th. It was a Summerfest back to school event. And we talked about some of the resources that our teen pregnancy prevention programs can offer there. I'll go through these rather quickly, excuse me. Teen outreach, we gave some goodie bags out, which include gift bags, hand sanitizer, some incentives for some of the folks. Gave a bunch of gift bags out at our Get Real summer program, which didn't look like the same as it did before in the past, but we were still able to make some connections there. Working with JPS students, primarily in the 5th and 6th grade, to look at some school programming there. Continue to collaborate with YMCA and St. Paul's Episcopal Church. We appreciate wholeheartedly their involvement in this effort. And then finally, we've initiated a Billboard campaign that you'll be seeing in the coming weeks if you haven't already, promoting parent-child communication around the topics, parents and how they're able to engage in the topics of sex with their children. And then the marijuana education grant, I may have mentioned this before to you. This is a state-funded grant that we get, and you know, the full amount of it is state funding. We distribute marijuana lock bags, if you will, so that people who are in the medical marijuana can keep that safely away from children and other youngsters in the home. We've conducted some focus groups there. Approximately 41 people participated, and they ranged from the age of 18 to 65. I'm sure we did that in a safe manner, likely remotely, as probably via Zoom. Also did some billboard campaigns here on how best to lock up and keep your medical marijuana safe, as well as safety awareness for pregnant and breastfeeding moms, as that's one of the target populations we want to be able to reach. We developed 4 videos that we're proud of to highlight how to lock up your products. Again, education for pregnant and breastfeeding moms, and impact of marijuana on youth and brain development and safe driving. So those are some of the target populations that you can see that we also try to educate through this grant. Matthew, as I mentioned, is on the call. He's our Division of Personal and Preventative Health. As I mentioned before, one of our programs to combat infant mortality is the maternal infant health program, normally done as a home visiting program, but right now doing services remotely. You can see our numbers there. In August, we did about 74 visits there, likely telehealth visits. In that same time period, we also have our Children's Special Healthcare Services program, which covers a lot of special needs diagnoses, over 2,000 diagnoses for children, and help families navigate through the medical system. We develop what are known as plans of care there, and we developed 29 plans of care. And in September, we did both 52 telehealth visits for both MIHP, Maternal Infant Health Program, and Children's Special Healthcare Program. Those are 2 specific and distinct programs, but magically, we did the same number of telehealth visits in the same month of September. We also do lead telehealth visits where we provide education on nutrition and provide some case management, some level of case management. were able to bill for those, and this was the highest billable quarter in 4 years. We're proud of that. We did about 19 of telehealth visits in lead there. I won't go through all the communicable diseases. You'll see all of them listed there. We tried to provide for you, Matthew did, in previous years so that you have for comparison, how are we doing? Of note, you see the Lyme disease one. We did do a press release on that. We did quite a bit of education on how to prevent Lyme disease, recognizing that folks are out there more, taking walks, taking hikes, things like that. So hoping to educate folks on doing that safely. Note in our gonorrhea, the cases have gone up slightly, a little bit, not by a huge majority, but a little bit. Chlamydia has actually gone down. But again, this is where that sexual health clinic is important and critical, that we can continue to test and continue to treat, such that we can help with our numbers to keep those numbers down. Identify folks early, hopefully screen people out if we can, those kind of things. I'll move on to environmental health. Just to note in our food program, good news is we've collected about $11,000 in food service fees. We've also, in comparison, that's about 14,000 more that we've collected this year. So thank you for approving for our fee increases there. That will help us tremendously there in terms of providing for covering our costs and for covering staffing support. So we've also collected about 73,000, excuse me, food handling, plan reviews, temporary food events, things like that. And that unfortunately has been a little less this year, but not notably, or likely notably to the pandemic. Probably people aren't holding as many events or serving food in that regard. So it is a bit less than what we've had in previous years. We've had some churches, we do have this as one of our things in our fees, that people can ask for a suspension of their license fees. And of course, given all the financial issues that some places are going through right now, it's not a surprise. 3 churches have asked to suspend their fees, license fees, so those won't be fees that we'll be collecting this year, but that is quite understandable considering what everyone is going through. For our temporary food events, as I mentioned earlier, it looks a bit different this year because people weren't holding events or having food served, so we have about $17,000 less in revenue there. But the other good news is, going back to the good news, we don't have any establishments that we know of that we have closed knowingly. So that's good for business and the economy there. Well and septic, those would have gone into effect on October 1, so just shortly ago. They'll raise about $115,000 of expected revenue for this coming fiscal year. So hopefully we keep up on our activity there. The other bit of good news is we hired our 6th sanitarian. Thank you very much for giving us approval to do that, in part because we were able to set these fees and cover that person's salary. So that person will be working in the well and septic program primarily. So hopefully we will not have as much delays or no delays in that area to do inspections and permitting. And he'd also be working the soil erosion sedimentation program. So we're glad to have him on board. You can see the number of the amount of revenue collected for septic and well there. I'm not going to go through that. Glad to see that. Campgrounds and pools, majority of the outdoor pools have opened up this year and were inspected. Indoor pools closed in March, but we recently got that 25% capacity as per the order. So we're catching up on a lot of those inspections there. Finally, I will move to our favorite topic, coronavirus. As to start out with our numbers, on the statewide side, as of, I only have numbers as of Saturday. The state reports 134,656 positives. That is increasing there, and they have 6,891 deaths. So again, increases occurring there. On the Jackson County side, as of today, Matthew graciously notes our numbers each and every day, including the weekends. We have 1,326 positives. Of those, 571 of those are male, 755 are female. But the good news is 880 have recovered. So if you take that 880 and minus it from the 1,326, you'll get what we're dealing with on an active case level today. So I'll also note that, as I mentioned before, our cases are increasing about almost to 20 per day at this point. So we are on the rise. We're not quite into the second wave yet, but we are keeping an eye on this, a close watch, and that the case numbers are rising. We are at a little over a 3% positivity rate as well. Going back to the data a bit on demographics, 7.3% of our total positives are within the less than 18 years of age, so the school age population primarily. That makes up about 97 of our cases, of our total cases are children. We have about 83 of our cases within that total that are made up of outbreaks in congregate care facilities. So again, these won't be prisons because those are noted differently on the MDOC side, but these are primarily our nursing homes, skilled nursing facilities, things like that. So we are dealing with, some outbreaks in at least one facility right now. We've had a few deaths there as well, and we're continuing to work through those issues, working through community mitigation strategies to help them through that, helping them secure some alternative staffing if they need it, and continuing to encourage the testing to see what's going on in the facility and assure that the positivity rates go down. We've worked on some school outbreaks. I'm not going to name them all, but you see some of them listed here, and probably in the time that I wrote this report, there's been even a few more. Schools do take up quite a bit of our time in terms of contact tracing, case investigation. And this doesn't necessarily mean some of these might be the school environment itself, where COVID may have been, or it could have been for folks who are working in the school, but may have done things on the weekend, or children who did after school activities or things like that. So it's a combination of different factors, as you can see, affects the school population. So finally, I didn't put anything in here because it didn't happen yet. That Supreme Court ruling I mentioned in some of my updates this week or on Friday to you. We continue to educate folks on masking, washing hands, social distancing, avoiding large gatherings. MDHHS has also issued some orders in that regard. So between that and the governor's executive orders, I believe that are still in place for at least 21 days, or shorter than 21 days now that it's been a few days have passed. We continue to educate folks on that. We do hear some messaging, some negative messaging on social media. I'll mention our website, things like that. I understand people are angry. I think folks are definitely feeling it and want to express that to us. We try to educate the best science that we have and the best information that we have and the latest and greatest, referring to the CDC and that kind of thing. So, it's been challenging, I'm not going to lie, but staff has been doing a tremendous job. So, I think that's it. I've said enough.
All right, committee members. I see Mr. Bear waving his hand already. Take it away, sir.
Hello, Rashmi. These positive test numbers, to help me get that in perspective. You say that we are increasing our positive tests about 20 persons per day.
Correct. 20 cases per day is what we're increasing by.
Increasing. Okay, so if we're doing 30 tests a day and finding 20 new positives, that's different than if we're doing 200 tests a day and we're finding 20 positives. So for me to keep this in perspective, how many tests per day are we actually conducting or performing?
So we're not doing the testing. Henry Ford Allegiance Health is still doing testing as well, Center for Family Health. Just this morning, I heard on the ICS call with the hospital that they're averaging about 200 to 250 tests per day through their drive-through clinic. That's at Henry Ford. And then Center for Family Health, I'm sure it's not as much as that, just because of their capacity. I think it's probably less than that. I'm not even sure if it's 100 per day. I would note you're right in terms of perspective wise, but what we want to see is of the total and the big picture wise of what's going on in our case positives. We're keeping an eye on what that trend looks like. And as I say that, I say our trend is going up with 20 cases per day of our total cases. So I can't say to you, I could probably find out from Henry Ford today how many they tested at the end of the day and how many of those came out positive. I could try to get you that. But what we look at is really the bigger picture wise of what's going on in the county as a whole. Hope that makes sense.
Okay, so yeah, that gives me some perspective, 20 a day out of 250 tests. When they perform this test, if they were to test me today and I had it, I came down with COVID in June, didn't even know it because I was asymptomatic. And I was tested, I was never tested then. Hypothetically, I'm just making up a story here. And I'm not tested till today. And they find that, yeah, a month ago I had it.
Mhm.
Can you tell in these tests that you are performing, is this a recent infection? Is this an infection that I may have had 3 months ago and never even knew it? I'm trying to gauge the severity of what is going on in a realistic manner.
So that's a great question. I think the science of that is still developing. Commissioner Bear is probably the best way to answer that. A lot of folks would love to get an antigen test, if you will, or to see if they have any antibodies, an antibody test. Like once you've had it, is it likely that you're going to have a smaller percentage of getting it again? Unfortunately, the science of all that is still being worked out. I will tell you, just this past weekend, we had a situation where somebody continued to test positive. But when you look at the timeline of how many times that was, their infection rate was probably lower, given it was 30 or it was 90 days, I believe, or somewhere close to that, of the fact that they continued to test positive. So, it's still, a lot of that is still being figured out, but the likelihood of that infectiousness. But I will also note, though, there's also situations where, say, somebody has an immunocompromised or chronic medical condition or some other respiratory thing going on, and they're just having, their immune system's having a really hard time fighting this off. They will, if they continue to get tested, they may likely continue to be positive. How much of that virus they have in them and how much of it is shedding or how infectious they are, it's going to be on a case-by-case basis. But I don't know if that science is quite there to say, hey, Commissioner Bear, like your viral load is X, that kind of thing. I think a lot of that's still being worked out.
Okay, thank you.
I will note too, I apologize, I forgot to tell you, Henry Ford's hospitalizations that I heard of this morning at their ICS call is at 18. So that number is going up. They've got 2 folks on ventilators, which is not a lot, but again, keeping our eye on that number.
Thank you, Rashmi. Commissioners, are there any other questions? Rashmi, I do have one question before I celebrate this. In regards to chlamydia, I'm always keeping an eye on the STDs and stuff like that. And that's like almost a 50% reduction in the numbers that we had from last year. I'm curious if, in your opinion, is that like truly a reduction in the presence of chlamydia in our community, or do you think it is because of the COVID environment and maybe less people actually going to get tested?
Yeah, I'm going to presume here that a lot of it has to do with testing, Commissioner Mahoney. I think the activity continues to be there. I think part of it is, again, are we, having our clinics are open minimally right now. We haven't been able to do outreach like we have done in years past. Likely we would pick up, more cases through that way. So I'm going to say it's likely because we're not able to test as much. But
okay, well, even though that might not technically be a win, we're going to count it as a win anyway. And I will say congratulations, and hopefully, fingers crossed, we don't find out next year that we got twice as many. So that would be my only question and comment. And thank you very much for the report. Commissioners, are there any other questions from the commissioners or the committee? All right, I think that takes care of everything. Thank you very much, Rashmi. Appreciate it. And the next item on the agenda is under other business, and we need a motion and support to pay the claims. All right, it's been moved and supported. Any questions, comments, or concerns? Seeing or hearing none, all in favor, show a sign. Next item is item B under other minutes. If you would like to take a look at the DHHS board minutes for your review. November reporting schedule is going to be the medical examiner, health department, Lifeways, Department on Aging, and MWSE. And any any public comment?
No public comment.
All right, thank you, Michelle. And is there any committee member comments? All right, seeing or hearing none. At this time, we will adjourn at the call of the chair. Everybody have a good day.